Good evening everyone, this is Anupama Menon welcoming you to a brand new episode of BMC Global Live Al-HILAL Health World, nothing but lifestyle. Good health is not a destination, it's a journey. And in this talk show Health World, we have expert doctors from various fields providing valuable information to assist you all in your journey towards good health. Fractures are a very common occurrence. It comes uninvited, it can happen to any person anywhere. And it's very important that we know how to deal with a fracture patient if a situation arises so that we can minimize the damage and make sure that things don't go out of hand or things don't get worse. And today, to discuss this topic of fractures, we have with us Dr. Abraham George, orthopedic surgeon at Al-HILAL Hospital, Manama. Dr. Abraham George has over 30 years of experience in this field and he is an alumni of the prestigious Christian Medical College, Vellore. He has also undergone trauma surgery training in Germany. Doctor, we're delighted to have you with us today.
Thank you.
Thank you for joining us. So before we begin, for the benefit of the viewers, can we start by explaining what exactly is a bone fracture?
A bone fracture is actually a break in the bone. So people many times get confused with the word fracture and bone break because they come and say like, is it break or a fracture? But theoretically, practically it is both the same.
Okay.
So it is a break, and so usually people are obvious of it. Only thing is they don't know immediately what to do. So what we are trying to discuss over this time is to tell you a little bit about how we can manage if you suspect a fracture at home. So before we go on to that, I'll tell you what a break in the bone is. What we classically talk about it is actually like a bone snapped.
Okay.
But it's not always like that. It can be different types. So we'll discuss about it also as we go on.
Okay.
And so many people want to know like whether there is only a hairline fracture, what they call as a crack, because they are more comfortable with that terms. But medically, even what we call as a crack is also a fracture.
Okay. So if you could just explain to us in detail what are the different types of bone fractures that we have?
Yeah. So when we classify fractures, it's a big list, so I'm not going into, I'll make it simple,
Okay.
which is important for us to know, because fractures can be basically open or closed. How we say that is, the medical term for it is compound fracture and closed fracture, but open fracture is when the skin is breached or broken.
Okay.
So which means usually the bone comes out of the fracture. So also it can be just a communicating wound connecting to the fracture. The reason why we need to know this is because the compound fracture is more or less an emergency compared to a closed fracture. If the closed fracture, the patient is comfortable,
Okay.
we don't have to rush immediately, we can make the person comfortable and take our own time. But it's an open fracture, it is more of an emergency. Then we also talk about complete fracture, incomplete fracture. Generally what we see in adults are all complete fractures where the bone is broken completely. The incomplete fractures, we also call it as many times as what is called green stick fractures, usually occur in children because their bones are soft. The fracture may not go through, they might have a crack which is not completely exposing the other side. So that is what is called an incomplete fracture. Then we have what is called displaced fracture where the fracture fragments move,
Okay.
or an undisplaced where it is in place, or sometimes the bone itself is crushed into many pieces. We call it as combinated fracture. So these are all terms which we use basically how to manage these things.
Okay. And like you said, an open fracture is a major one which is a cause for concern and it requires immediate medical attention. So who are more prone to getting it? Because is it the elderly people because their bones tend to be brittle, or is it kids? Which age group is more likely to get a fracture?
The fracture can occur in any age group. But what we are trying to discuss between is the fracture in a normal bone and fracture in a weak bone, or what we call as brittle bone, which can occur in children in certain diseases. There is something called a brittle bone disease,
Okay.
where the bone is brittle. So in children also you can get with the difference is that the impact of or the injury may be a major for somebody who is normal bone to get a fracture. But in an older person or somebody with a bone disease, with a minor trauma, like in old people, sometimes they just walk.
A minor fall or
even sometimes they fracture even without a fall. They suddenly twist their bone and they can get a fracture.
Okay.
So this is the importance where it comes about the weak bone and the normal bone. But if you ask me, there is nobody who is exempt from a fracture because it can happen to anyone depending on the strength of or impact which occurs or the bone suffers from.
So what exactly causes broken bones?
So basically the bone is one of the strongest organs in the body. The only structure which is stronger than bone is the enamel of our teeth. Other than that, the bone is strong. So it takes a lot of strength. So it can happen in sports injuries, it can happen in accidents, or it can happen from a simple fall, domestic falls, and some trivial injuries also will occur in people who have the bones which are not strong.
Okay. And what are the symptoms to look out for? Because normally when we talk of fractures, the first thing that comes to our mind as layman is a swelling or some other physical manifestation. So what are the signs that a patient should look out for if they suspect a fracture, if something happens at home?
When you suspect a fracture in the limbs, like in the legs or the arms, it is very easy actually, because immediately they start not moving, they become incapacitated. And usually if they have a fracture in the lower limbs like the hip, knees, legs, anywhere, usually they won't be able to weight bear on that. So that is one of the easy ways of finding a fracture in the lower part. But then again, what you said is also common. In any area you can get a swelling, you can get sometimes if it is an open fracture you will have bleeding from there. So all these can associate with that. But if there are some fractures which are difficult, because many times in an old person, like you were saying earlier, the weak bones, they can actually fracture the vertebral bones. That's the backbones. So that many times we may miss it because they will consider it as a back pain and they might not immediately seek any medical
assistance.
And there are rare fractures where the bone is impacted. It means the fracture is broken and it is stuck with the other part of the bone which is broken. In that case also they may not immediately have all the symptoms which we are discussing about. So that is why it is important always to consult if you are suspecting a fracture.
And normally we tend to go into a panic mode when we see somebody fall or when we fall ourselves. So we may end up doing the wrong thing. So can you just give some tips to our viewers on how to handle a situation? Let's say we suspect a fracture, we are at home. So how do we handle that situation?
So if you suspect a fracture and the patient, had a specific injury or sudden pain and things, then first thing to do is try not to move that place.
Much.
See, most of the people make a mistake of when they suspect the fracture also they will try to massage.
Yes, that's a natural instinct.
Which is one of the things which can make things worse.
Okay.
So if you suspect, the first thing is to rest the place. So that you can do with even a small cushion or something which supports like a blanket, or you can even roll up some paper and use it like a support. So, and the thing is about fracture is how to support is simple. It's almost like holding or cradling a baby.
Okay.
So which means you have to hold above and below where you suspect the fracture. So it should be long enough. So for example, if you suspect a fracture in the forearm, then you have to support from the elbow up to the wrist. Means you have to above and below joints normally should be. That's a general rule. So should be basically supported until we get to somewhere. But if there is an obvious thing and then you can
open
fracture and those things, of course you need a first aid, you can wrap it. And then better not to apply, because there are a lot of people who when they have a fracture also they will apply turmeric, things like home remedies. So home remedies are not really recommended for when you suspect a fracture. So till you are able to get somewhere and confirm the things, the important thing is support. So especially in the upper limbs, you can use any cloth lying at home, fold it into a triangular piece and use it as a sling, which can at least give them some comfort.
So
And
basically,
also, yeah, tell the patient themselves, because sometimes they won't allow if there is a lot of pain. Then ask them to support themselves. Most of the things you can support onto your body itself, which the patient may be able to do. So that maybe they will themselves do it, but they may not allow another person.
So basically movement has to be restricted, it has to be minimum, and home remedies to be avoided and massage to be avoided at any cost. So what are the tests normally done to determine whether there is a fracture or not?
So once you're suspecting it and once you get to the hospital, there are a whole lot of tests which we can do. The basic thing which everybody knows is the X-ray.
X-ray, yeah.
So there are some cases where the X-rays does not show, especially things like stress fractures. Stress fractures occur without any particular injury, like if somebody who's not been running suddenly decide to start long distance running. It also happens in people who are put into training in the army, who are put through rigorous exercise.
Which they are not used to.
Yeah, these are sometimes called march fractures, stress fractures. All these things X-ray may not show. In those cases, you might need to do what is called a bone scan. Bone scan is a long process. You have to inject what is called a radioisotope dye, and then you have to scan and look for increased uptake. So another test which, when you're not sure about how the pattern of the fracture, so fractures also have its own pattern. Sometimes it's a straightforward, that's called a transverse fracture. When it's at an angle, it's called an oblique fracture. When it's like a spiral around, it's called a spiral fracture, which sometimes you may not be able to see the fracture pattern in an X-ray, because X-ray is only two views. It's like taking a photograph, 2D photograph, and identify a person, you know, like all features, which we can't do. So then those cases we use what is called a CT scan or a computerized tomography, where actually these are X-rays which are reconstructed in a computer to form like a 3D
three-dimensional view of
and three-dimensional view. So we can, with the 3D reconstruction, we can very easily see the fracture pattern, and you know, the planning, everything can be easier. Then of course these days also MRIs are used sometimes to detect these stress fractures, where you might see the soft tissue better, because many of the fractures will have a blood clot around it, which we call as hematoma. So that all can be seen better in an MRI scan. So these are the common investigations which we do.
And when we talk about treatment for broken bones, the first thing that comes to our mind is a cast, and you know, where you write messages and all that. So is the same method still followed? What are the treatment options available for broken bones now in today's times?
So the treatment wise, things haven't changed so much, I would say. The casts have improved. Now there are fiberglass casts, there are moldable casts which comes like prepared, so we can just warm it and mold it and put it around. So things there are a lot of improvements like that. But basically the cast basically is an external support, and that continues.
It has to be there.
It has to be there. Only thing is, there are some conditions or situations where we can't manage with a cast. Means we may not be able to hold the fracture properly to heal in a cast. Coming to the cast or any treatment, we are only putting it together for the healing to occur. No treatment has been discovered so far to heal a bone on our own. So we basically give the body time and align it and keep it in place. So when a cast cannot hold it, then we use sometimes what's called special nails or rods which goes through the bones. Sometimes we use what is called plates and screws to align the bone and fix it. And sometimes we use what is called external fixators, where the bone is held from outside. So this usually happens when you have a bad compound fracture, where the wound needs to be dressed daily. We cannot use a cast or something close. So, or even it may be too contaminated or too dirty to put a plate and screw straight away. So in those cases we use what is called an external frame. All these serve the same purpose. It's all basically to keep the bone aligned for the bone
place,
to heal.
so that the healing takes place. So how long does it take normally for a fracture to heal? I'm sure it depends on the nature of the fracture, but
so the fracture usually takes, as a general rule, it takes about 1.5 months or 6 weeks for the upper limb,
Okay.
and for the lower limb it takes 8 to 12 weeks, that's as long as 3 months.
3 months.
But
okay.
there are special situations where sometimes in an elderly person we may not immobilize for them for that long,
Mhm.
mainly because if you keep them immobilized for long they become stiff. So we sometimes compromise. In an elderly person with a similar fracture as a young person, we might remove the fracture, the cast early, and try to get the movements back.
Okay.
Because in a young person there is no issue about the time period, because children, like if they have a fracture,
They recoup
once they
very
heal they
fast.
will
Yes.
recover very fast, they don't get joint stiffness. And one of the other things which rarely we use is what is called traction. Traction is we put weights,
Mhm.
and not very much used in an older person,
Okay.
but still used in small children where the bones can be aligned with the traction, so not to operate. One of the issues about operating on a child is because their bone is growing.
Mhm.
So sometimes they outgrow what is the surgery is done, so then we have to go in quickly and remove those. So all this consideration, so in children sometimes the treatment varies a little bit.
Okay. So once a person gets a fracture, are they more prone to having a fracture in the same place in a later stage, or
It only occurs, what I have seen in my experience is when you move them, especially in children,
Mhm.
you move them very early. Like I have had children who had broken their bones, put into a cast,
Mhm.
and they go and play football with the cast, and they fall down.
Again.
As it was healing, they break it again.
Okay.
But generally, once the fracture is healed and the bone is back to normal, there is something called remodeling which occurs in the bone.
Okay.
So I don't want to explain, but generally the bone forms extra bone outside and which heals. And once that is formed, the inside bone which is broken again joins slowly, and its outside bone is removed. That's called remodeling.
Okay.
That can take up to 6 months to even a year. So once that happens, the bone is as good as the original bone. So
Okay.
there is less chance. But only problem that happens when you don't move the hands, or like I said earlier, you don't mobilize, there is a chance that the bone can become more and more weak.
Weak.
So which, if you don't mobilize them early enough, the weak bone can break easily again.
Okay. So what can be done to prevent broken bones? Is there anything that you can suggest, any dietary changes to make sure that your bones are stronger, or any exercise? In your opinion, what can we do as part of a general lifestyle?
Like any other accidents or things,
Mhm.
the thing what we have to do is to prevent an fracture, the question which you asked.
Mhm.
To prevent the fracture, we have to basically look at what caused it. So in an elderly person or even children, most of the time it's falls.
Yes.
Children, of course, we can't avoid falls because they almost fall every day. Only thing is the impact sometimes becomes bad, and then they may fracture a bone. But an elderly person, there are a few considerations which you have to do. One is like you have to check whether they are balanced, in the sense many of them have some problems in the ear or
Even knee
neck
problem could
problems,
lead to imbalance.
so in
yes.
those cases they can use a walker or a frame which will support them and help them in balancing.
Okay.
Second thing which usually happens is the vision.
Mhm.
That's why we insist on them getting a eye checkup.
Okay.
So if the vision is poor, so many times they might miss a step, or they might
Yes,
not
they
see
could.
something,
Yes.
so which actually can cause a fall, and that can cause a fracture. And the other thing is about home. Many of the things which we have to worry about is like what is making them trip. It can be a loose wire, because these days electronic things are all over the house.
Yes.
Children are there, means
Slippery
they might have,
floors maybe,
they
wet
might
and
trip over
slippery
a
floors.
wire, so
Yes.
you have to make sure there's no clutter.
Mhm.
And if there are children, make sure that there are no toys left
Lying
in
on
their
the floor.
way.
Yes.
Third thing is the lighting. It's also very important, because
Okay.
poor lighting can also, they may miss all these things.
Yes.
So the lighting has to be good. And these days they recommend even keeping a floor light during the night So in the rooms,
Sensor
they
lights.
see things,
Yes.
sensor or even a light
Yeah.
which lights up the floor. There are also things like outside steps they can miss. So people say if you have an elderly person at home, leave always a porch light on, because if they come and go or something, they should not miss the steps. So the same thing happens when they are walking outdoors also. Many times people, what happens is, even when they walk on a footpath, they might miss the curb. So,
Yes.
so they might trip and fall there. And so these are the basic things to avoid. Of course, accidents we cannot completely avoid, because that's
Exactly.
not
Yes.
these things. But we can take care of at least these things to protect ourselves.
Okay.
And the next question, I think you asked about the nutrition part.
Yes.
So there is something called osteoporosis, which is becoming a very, very common problem now. The main reason why it is happening is because people are living longer. Because osteoporosis is, other than special considerations in the children, osteoporosis is a problem of the elderly.
Okay.
So that is something which needs to be checked and needs to be managed. But even if you're not checking, there are two things which we can do it on our own. One is the supplements. Basically, one of the common things which causes osteoporosis these days is low vitamin D.
Okay.
And especially we are becoming more sedentary, because vitamin D is, as you know, it's a sunlight vitamin.
Yeah,
which
especially in
can-
Middle East, I think we are more
Middle East, there is no
prone to
lot
having
of,
low
lot
vitamin
of
D levels.
sunlight.
Yes.
But vitamin D levels are low in the Middle East for two reasons. One is because the sunlight which produces vitamin D is the one which needs to have UV rays, which is abundant only between 10 and 3 during the day. And in the Middle East, that's the time it's very hot.
Yes.
And many of us who are working also will be in office bound or inside, indoors.
Yes.
And even if you stay behind the glass blocks the UV rays. So we don't get the advantage of the sunlight here. So if it's good to check at least once in a year and supplement ourselves, because that's one of the easiest ways. Then second thing is, even if your vitamin D is corrected, you need calcium in the food for the bones to become strong. So there are a lot of foods which you can decide, what you want. There are almonds, they talk about milk products, they talk about cheese and tofu, those who are vegetarian. So there are a lot of things which are containing high amounts of calcium. So the calcium is needed for the bone to stay strong.
Okay.
And there are other medications. In spite of all these, if your osteoporosis is severe, there are medications actually, I don't want to go into the details, but which are available. Injectables are there, tablets are there, which is to prevent osteoporosis or treat osteoporosis. There are treatments.
For normal people, I think we have to take care of a calcium intake, and vitamin D we need to get it checked regularly.
And, these days actually children are given vitamin D drops without even checking.
Okay.
Because so it's become, people have started,
there's more awareness about vitamin D
about the
deficiency.
vitamin D
That's
now,
right.
yeah.
And doctor, what are the complications that could arise from a bone fracture?
There are two, I will describe it as two stages. One is, of course, the immediate after a fracture occurs. It can affect the nerves close by, can affect the blood vessels close by. So immediately one of the things which the person says, they have fallen down, we suspect a fracture, and they are not able to feel their feet or hand, then that means obviously some nerves are getting damaged. So that is more or less one of the early complications. Then you can also have blood clots in that area, bleeding, hematomas, blood clots. So all those things are immediate things.
Okay.
Of course, once you started treatment, even with a cast or any other methods, again you can get these similar problems, because if the cast is put and then the patient doesn't take care and keeps the limbs down, it can swell up inside the cast. As you know, the cast is not forgiving. So if you swell up inside the cast, it can compress on the nerves, blood vessels. It can cause decreased blood supply, can also affect the nerves. These are all emergencies which we have to handle. Sometimes even without all these, some of the fractures, the bleeding itself can cause a pressure increase inside the muscle itself. So that can also affect the blood flow and the nerves. So these are things which are the common complications. Yeah.
Okay, and let's say a patient is under treatment for fracture, he's at home. Are there any symptoms to look out for where you feel the patient should again go back to the doctor and check if everything is going fine? Any
Yes.
warning signs?
Yes, some of the things which we always tell the patient whenever we apply a cast or a treatment we given is to check for the movements, like if they suddenly develop unusual restriction of movements or stiffness in the hand,
Okay.
and the hand or feet start swelling up. These are all worrying things, because usually after prolonged surgery, treatment and bedridden, patients usually can develop what's called blood clots in the, that is called the venous thrombosis, or blood which gets
Okay.
blocked. That is one. Second thing is like if the pressure is too much, like I said earlier, if it affects the nerves, which causes numbness. So these are the two things, main things which we ask the patient to look for. One is the numbness which they feel. Sometimes the limbs can become turn blue or pale.
Okay.
And one of the ways of checking for the blood flow, because when you have a cast you can't obviously check the pulse like we do normally, is what is called capillary filling. So
Okay.
we see the nail bed filling up, that we can all see. So that is one of the reasons, again we say, if somebody is wearing nail polish, so we should get rid of it before, after the, or at least after the treatment, because that's where we check for the blood flow.
Okay.
So these are all things which we can look at. Also they can suddenly, if it's a fracture site, they suddenly develop excessive swelling or increased pain. These are all things to look for, that there's something is wrong. So these are all situations where they have to go back to whoever has treated
Doctor
them and
seek
check with them.
medical attention. Doctor, it's time to wrap up this episode. So before we sign off, would you like to share some takeaway advice for our viewers on fractures and how to deal with it? In a nutshell, if you could just explain what we discussed
Yeah,
today.
like any other disease or any other problems which we have, of course the first thing is prevention. I think I mentioned a lot of them, especially for the elderly people at home. There are things to take care of and worry about to prevent a fracture.
Yes.
So that is the first part. Of course, if a fracture occurs, like I mentioned, you have to suspect it also, immobilize the area, seek early attention, and get checked whether
Okay.
they really have a problem. So once the treatment starts, basically you have to follow instructions, do exercises, mobilize, everything needs to keep ourselves moving. That's the main thing which keeps the bones and the joints in place. And finally, if you develop any complication even after the treatment, better than waiting at home to see whether it will come off on its own or trying our own treatment methods, it's better always to go back and check.
See the doctor.
Okay.
Thank you so much, doctor, for taking out the time and for explaining us to us in detail about fractures. Really appreciate that. Thank you so much for joining us today. Friends, I hope you found this episode very informative. For more informative episodes like this, don't forget to tune in to BMC Global Live Al-Hilal Health World every Tuesday at 8 p.m. I'll be back next week with another topic. Till then, stay healthy, stay happy. This is Anupama signing off. Good night and take care.